it's basically like 21st century model of healthcare. Like some people call it medicine 3.0, where we're not just taking the best of science that's published in the form of like human clinical trials and long-term observational studies, but we are bridging the best of the evidence of what's seen in these trials with personalized health data. So it involves extensive testing, like, and interpreting the testing in the correct way, like not relying on standard laboratory reference ranges, but trying to pick up dysfunction as early as possible. So we have a very preventive model where we are trying to test aggressively and extensively in an early stage, so we can pick up mild dysfunctions also. Like for example, you don't have to wait till you develop diabetes. You can catch very early physiological disruptions in the insulin response, like before it even progresses to pre-diabetes or even to insulin resistance. Similarly, for kidney decline, like you don't have to wait till your creatinine is already high and then you think of intervening. You can catch early kidney dysfunction. So for every single chronic disease, we have early markers which can help us to intervene at an appropriate time when the damage is less, and that gives us the maximum chance of success. So it's basically taking the diagnostic data and not using pharmaceutical medications, whereas trying to find the actual causes for why these diseases develop to begin with, which are rooted in diet, lifestyle, nutrient deficiencies, heavy metal overload, and various other functional factors, rather than having that mindset where if you fall sick you just take like paracetamol, if you have pain you take ibuprofen. So it's getting out of the whole culture and actually starting to think about how are your lifestyle, diet, and nutrient deficiencies along with some other factors contributing to the development of chronic disease, and then taking control at that level by changing
making your house earthquake proof, and not once the earthquake hits, that's when you get.
Yeah, it's a very conventional medicine is very reactionary, and there is a very important place for emergency medicine and for doctors, but that should be ideally reserved for when people have got to that stage where we can't really, it's very difficult to reverse with these factors. But for most chronic diseases, this should
what are
always be
diseases for people. I'm sorry,
it,
I'm going to
no,
ask
no,
you
we can dumb it down. We try to dumb it down as much as possible.
Yeah.
I might say some things assuming some knowledge, but you can always kind of make me simplify things further. So chronic diseases are a complex set of like multifactorial processes which land up developing into a problem which has effects on many body systems. So it's different from a symptom. Like I'll give you some examples that like contrast between a symptom and a disease. So acne can be a symptom, but PCOS can be the disease. So when we say PCOS, I mean polycystic ovarian syndrome. It's a very common problem that a lot of women suffer from. So it's a very multifactorial disease which is accompanied by increase in inflammation and insulin resistance and imbalances in the gut microbiome and a lot of other things, which not just make someone have acne, but increase the risk of different diseases because the women have high testosterone. So that has other effects on like not just acne, but even facial hair, developing actual cysts, in the vaginal area. So a disease has much wide-ranging implications than a symptom. Like for example, if we take diabetes again, which is very common. So people often experience like retinopathy. They'll get damage in the eyes and they can go blind as a result of having diabetes, or the nephrons in the kidney get damaged. So that can lead to kidney disease and then the symptoms of that eventually. So that's the basic contrast overall between a disease and a symptom.
Yeah, right. That makes sense. So chronic disease is basically the root cause of a symptom that a person is facing, right?
Yeah, and the disease itself, depending on which disease we're talking about, there are different processes going on that will lead to the disease outcome, and then that will have its symptomatic effects.
Makes sense.